Welcome back to Stribling's New York. I'm your host, Rob Taub, on 710 WOR Radio, an iHeart Media company. We're joined on the phone all the way from Houston, Texas, by Dr. Jeffrey Brown. He's an endocrinologist and voted one of Houston's top docs. Hello, Jeff.
Hi, how are you?
I'm doing well. I wonder if I should mention as a type 2 diabetic that our first meeting, you and I went to the Carnegie Deli and had pastrami sandwiches.
Well, that's actually a good comment because you would normally think that eating that type of thing would be bad for you, wouldn't you?
Yes, but I wasn't hungry for the rest of the day.
Well, so you know why? Because you had protein, fat, and carbs. Because remember, you had a sandwich. It was on bread, right?
Rye bread with some delicious mustard.
Right, and I think it's the mustard that really makes the sandwich, I have to tell you. But, yes, you see, that's the thing in diabetes. People don't know when to eat or what to eat. And, most people, and you know this to be true, most people think that you should eat a bunch of protein, that carbs are bad for you, and fat is bad for you. That's not true, okay? Now, you know this to be true. You know that if somebody just takes all protein, it'll actually screw with your sugar, your carbohydrate metabolism. And this idea, I see a lot of patients, okay, and I talk on diabetes all over the world, okay, and other things too. And this idea is that you should just eat protein, no fat, no sugar. Our bodies aren't made like that. Our pancreas isn't made like that. We need to take in the right amount of protein, fat, and carbohydrates. And you know what the biggest problem I see in terms of doctors? Who's supposed to be advising patients? Doctors. Do you know that most doctors don't know what to eat, when to eat, and when to exercise?
Do medical schools even teach nutrition?
They do, but not very well, okay? Well, I have to admit that, and the other thing is, not all doctors know all things. Dr. Kildare, Dr. Welby doesn't exist. So you can't do brain surgery in the morning, deliver a baby at noon, okay, and fix a broken bone at night, okay? There's just too much nowadays. But the ones that are trained in nutrition are actually people like me, endocrinologists. And when I give talks, the doctors don't know what to tell their patients, okay? They read it in the magazines, people magazines, not in medical journals, or see it on TV or radio shows, not as sophisticated as yours, of course, okay?
Why, thank you.
You're welcome. And so when I ask the question, when I give a lecture, I say to the doctors, when is the best time to exercise and eat? And I get answers all over the world, okay? They'll say, well, anytime you exercise, it's good. That's not true. Or don't eat in the morning, or don't eat in the afternoon. No. As you know, I treat a lot of elite athletes. And the one thing I don't have to tell them to do is when to eat and exercise. You know why?
They're always eating and exercising.
All day. We're made to have, our diets are made to really be at each meal or each time you eat about 45% protein, 45% carbs, and 10% fat. Even a diabetic needs fat. And the best time to exercise and eat? Well, the best time is to exercise is after your biggest meal of the day, and you got to be eating at least 3 meals a day. Now, Rob, I don't know about your mother, but my mother, and she used to get pissed off at me all the time, okay? I was a bad guy, okay, as growing up. I didn't listen to anybody. And when she was really pissed off at me, she'd say, Jeffrey, you just had a cheeseburger. If you go and swim now, you'll get cramps and die. Did your mother say that to you?
Of course she did.
Yeah.
Many times.
And by the way, yeah, and it doesn't matter where you go, anywhere in the world.
And I was standing next to the ocean with a stopwatch going, I have 30 seconds left and I can get in the water.
I was the same way. Our mothers were wrong. The very best time to exercise is after your biggest meal of the day. You don't get up and not eat and exercise. That's how you gain weight. It induces an enzyme. And there's even a name for it. It's called lipoprotein lipase. And your body, if you exercise and you hadn't eaten, then you release these chemicals, these hormones, that make it then when the next time you eat, it sucks it up like a sponge. Okay? So if you let's say you're 5 feet tall and you're not, okay? A person who is sitting on their behinds, not doing anything, the caloric intake to maintain a normal weight would be 1,000 calories, okay? Now, if you take that 1,000 calories and you spread it out over 3 times a day, you won't gain weight. If you take only 1 or 2 meals a day that still has the same total caloric intake of 1,000 calories, you'll gain weight. And the biggest problem people, especially with diabetes, they don't eat. They don't eat. You got to eat at least 3 times a day.
I eat. That's not a problem of mine. Is my blood sugar plummeting when I get really hungry? What causes people's hunger pangs?
It depends. Most of the time it is. But you got to be careful. With diabetes, there's a difference between a diabetic in terms of their sugar, their carbohydrate physiology, and somebody who isn't. So, for example, if your sugar, let's say your sugar goes up real high, if it plummets real fast, even down to a normal level, you'll get the symptoms of hunger pangs. You'll get lightheaded. You'll have a fast heartbeat. You might even sweat. Do you get sweaty when you get hunger pangs?
Occasionally I do. Yes, I try not to let that happen because I try to control my diet, but it can happen.
Oh, now, then the other thing is, then what do you eat? Now, most people think a good snack or a good diet for a diabetic is fruit. Well, let me tell you something. That's an old wives' tale, too. They say, well, there's something here, the refined sugar versus the sugar of a Hershey's candy bar, okay? Let me tell you something. Sugar is sugar, okay? And if you're going to eat a fruit, it needs to be with a protein and a fat. So a better snack would be a peanut butter on a bagel or a toast than a piece of fruit. Okay, fruit is not your friend if you do it all by itself.
How about an avocado?
Yeah, avocados are good for guacamole. I mean, there's not, avocados aren't bad, but the problem is that you got to have a combo. You got to have the combo platter. You got to, as long as you have normal kidney function, okay, you need to have, even at each snack, at each meal, 45% carbs, 45% protein, and 10% fat. These protein shakes or the all-protein stuff is terrible for diabetics.
Oh, I agree. So, you know what? I'm going to have you on the show next week. We're running into we're almost at 10 minutes. This has been flying by. So why don't we continue this discussion next week when we have we can discuss protein and so forth. All right. Well, thanks for joining us. And
my pleasure.
I will speak with you again soon.
Sounds great.